Alright guys, let's discuss about the cubital fossa. This is one of commonly used region in the bedside techniques, in the bedside procedures. As you can see, this is suppose my right cubital fossa. So as you can see the cadaveric structure. So this will be like outer side, this is the lateral side and this is the medial side. Okay, let me draw please. This is actually a triangular fossa, a depression in front of the elbow joint. So this is a triangular fossa or the depression in front of the elbow joint. So this is a really important site because there are some important structures passing through it like brachial artery that you have to auscultate while taking the blood pressure, and there are some important veins also crossing in front of the elbow joint like median cubital vein that you have to puncture in case of IV procedures, or you can take the blood for ABGs from this brachial artery. As you can see, this is end artery here. So you should understand first the borders, like this is the lateral border, like this is the lateral border. So suppose this is my right cubital fossa here. So this is outer border is the lateral border. So this is the brachioradialis muscle. This is brachioradialis muscle. So this is suppose my lateral border. So this is called as brachioradialis muscle. So this is brachioradialis muscle. On the medial side, on inside here you can even see the medial epicondyle of the humerus also. So you can see this is the medial side. So medial side you can see this is the pronator teres muscle. Pronator teres muscle. So on the medial side. So it's mean this is the lateral boundary of the cubital fossa, this is the medial boundary of the cubital fossa, this is a triangular depression or fossa in front of the elbow joint. And what are the important structures passing through this cubital fossa? So first important structures, if you will zoom here, I can show you, you can see here, this is the first important structure and this is your median nerve. So it's mean that structure, most medial structure passing through the cubital fossa is your median nerve, is the median nerve. Is the median nerve. So here is your median. Median. Remember this is not medial, this is median nerve. So most medial, remember that M, most medial structure is the median nerve in the cubital fossa. Immediately next to the median nerve, the next structure here you can see this is the one of the major blood vessel here, and it's dividing into two arteries. Here you can see, that's why I call this is end artery here. So this is a brachial artery. You see, this is the brachial artery dividing into two arteries, radial arteries and then ulnar artery. You see the brachial artery here. So this is a brachial artery. So brachial artery is dividing into radial artery and then ulnar artery. So it's mean immediately next or immediately lateral to the median nerve, there is a brachial artery. This is a brachial artery. So brachial artery, this is your brachial artery, and next to brachial artery here you can see one of the tough structure there and very important structure. If you will put your fingers here and flex your elbow joint, you can feel this tough bend of the connective tissue. This structure here you can see, this is tendon of the biceps muscle. So this is your bicep muscle and here is tendon. You can see the tendon. So this is tendon of the bicep muscle. This is tendon of bicep muscle. So this is called as biceps tendon. So biceps tendon, actually this biceps tendon is attached with the head of the radius bone. So you should understand, it's mean when you are flexing your elbow joint, you are lifting entire forearm bone. This is because of the tendon of biceps. So it's mean that lateral to the brachial artery there is tendon of the biceps. Medial to the brachial artery there is a median nerve. You should understand that they might confuse you with these statements also. So medial to the tendon of biceps there is a brachial artery. And what is the most lateral structure in the cubital fossa? Most lateral structure again you have got this nerve, and this is the radial nerve which is coming from posterior side of the radial groove, and it's crossing to the anterior aspect immediately near to the lateral epicondyle. That's why lateral epicondyle fracture can lead to injury of the radial nerve also. So this is the most lateral structure in the cubital fossa. So most lateral is the radial nerve. So this is your radial nerve, and this is coming from the posterior cord of the brachial plexus, one of the strong nerve which help in extension of the elbow and extension of the wrist also. That's why any injury to the radial nerve lead to the wrist drop. So you should understand it, please. So guys, these are the structures of the cubital fossa. So you should remember that most medial structure, remember like this, most medial structure. So M, B, B, R. Most medial structure is the median nerve. Then next to median nerve you have got brachial artery. Then you have got tendon of the biceps. Then you have got radial nerve. So if they will ask you what is the structure, immediate medial to brachial artery in the cubital fossa, that is median nerve. Immediate lateral to tendon of biceps, that is the radial nerve. Immediate medial to the tendon of biceps, that is brachial artery. So where is the cubital vein? As you know that veins are basically immediately present under the skin and fascia. So it's crossing anterior to the cubital fossa. So here is your basical cubital vein, and this is the medial cubital vein, and you can puncture this vein while applying your IV procedures. So I hope you understood the cubital fossa and the significance of the cubital fossa. Thank you for your consideration.